Hi, and welcome to another edition of Seniors Today. I'm your host, Tom Bartee, and today we have a special guest, Mr. Frank Nelson, who is a regional program manager for an organization called HICAP, which covers educational information regarding Medicare. So, without further ado, welcome, Frank.
Thank you, Tom.
Thanks for being here today.
Sure.
HICAP is very important to seniors and, at this point, baby boomers, but very few people actually know what it is. Can you give us a quick intro on that?
Sure. HICAP, the Medicare Health Insurance Counseling and Advocacy Program. Years ago, Art Agnos, one of our California representatives, was helping his mother. And this was back in the early 80s. And unfortunately, he was really struggling to get answers related to Medicare. You can call 1-800-MEDICARE, or you can talk with an insurance agent who sells a product related to Medicare. But he was really having challenges getting some of the more technical questions answered. His wife happened to get involved and said, well, let's start an organization and a nonprofit. And over time, they started HICAP, which caught on and is now in every single state, and it's called SHIP, the State Health Insurance Program. And of course, California renames everything, so SHIP is HICAP. In Oregon, it's SHIBA. In Florida, it's SHINE. But essentially, HICAP does two things. One is an individual one-on-one counseling appointment that people can call and meet with a counselor in their community. And secondly is unbiased seminars that people can attend to learn about Medicare and be more educated about their options so that when they step out there and have to make decisions, they're hopefully able to make informed decisions.
So when you say unbiased, are you suggesting that HICAP doesn't really have a stake in the game in terms of who gets what carrier, what policy, or whatever, that you'll present the facts of the matter rather than try to sell somebody on a particular plan?
We don't sell anything.
Right.
Our funding is through the Older Americans Act and also some through the state. So, and we're a program underneath the Area Agency on Aging. So no, we do not sell anything. We are truly unbiased because we don't recommend any agents or companies or plans. Our goal is to be the source that a person can get help understanding, looking at all their options. For instance, people have heard of Advantage plans. Depending on what county a person lives in, there may be a few of them. Part D plans, D for drugs. There are 25 plans. So in explaining what your options are, how it all works, and giving you all the information of how to go about making that decision, then people are better able to go out there and make an informed decision.
At what age do you think people should start boning up, if you will, on the details and the information of Medicare?
Sure. Healthcare, always a complicated topic.
Yeah.
So when a person becomes eligible for Medicare, and of course there are two ways a person can become eligible. One is turning 65. And in that case, the window of time for them to enroll is 3 months before the month of their birthday, the month of their birthday, and 3 months after. So they have that 7-month window. So if they start educating themselves 4 or 5 months before, attend one of our seminars, kind of hear the bigger picture, and then with their list of questions, sit one-on-one with a counselor, then when they enter that window to enroll, they're more informed and able to make that decision. The second way people can qualify for Medicare is, of course, if they're disabled for 24 months. Starting on month 25, their health care transitions into Medicare. And that would be the same scenario. Several months before that, call up HICAP and set an appointment to really become educated about what your options are.
So HICAP, as you said, is in every state and virtually every county in every state.
Correct.
And that means that you're probably in Solano County.
Yes.
And where would that be?
That depends. We have several locations. The way that our program is set up is with certified volunteers. So this time of year, a lot of retired people who enjoy a challenge have signed on to be tax preparers. It's a similar model in that for our region, North Bay High Cap, which encompasses 6 counties, Napa, Solano, Marin, Sonoma, Lake, and Mendocino, the majority of the work is through the time that volunteers have given. Now, it takes a certain type of volunteer, who's typically retired, who enjoys learning, and it's quite extensive, the training we provide to learn a 3-inch manual and then go through a 2-month internship to then become certified as a high-cap counselor through the California Department of Aging, at which point we have set up agreements with certain sites for a desk and a chair. So maybe it's a senior center. Maybe it's space a few times a month at the library or at other locations that provide space for that counselor to meet with clients by appointment.
So somebody that's just learning about the services you offer could call the 800 number.
Yes.
1-800.
434-0222.
And that's 1-800-Medicare.
No.
No, that's different. Okay.
That's different. The number 1-800-434-0222 is the statewide high cap number.
Okay.
So interestingly enough, when a person calls that number, it looks at the area code and prefix of their telephone and routes them to the nearest high cap.
Or to your office, which is
If their phone is a 707 or a, what is the area code here, 415?
Yeah.
And they have a prefix, yes. Of course, the challenge is when someone moves from San Diego, because nowadays we carry our phones, we don't change our numbers, it would route them to a high cap in San Diego.
Yeah.
In which case, that high cap would say, well, let me give you the phone number for the high cap in North Bay.
So when you want to get this information, do you set up an appointment, or do you get a list of dates where they're going to have a seminar, or does it work both ways?
Couple things. If a person is wanting an educational seminar, they can go to our website, www.sasnb. We're underneath an agency called Senior Advocacy Services. High Cap is one of the programs. They also have the Long-Term Care Ombudsman and a program called Elder Justice. But if they go to the sasnb.org website, they can click on the calendar and see where the different seminars are located that High Cap provides, and then simply attend one of them. Or if they want an individual appointment, they can either, again, through our website, click that they would like an appointment, and it shows them the locations and the topics, and then we call them back to look at that counselor's schedule to see what appointment times are available and where.
So SASMB, Senior Advocacy Services North Bay?
No, senioradvocacyservices.org.
.org.
North Bay is just the general term.
Oh, okay. All right, so senioradvocacyservices.org.
Correct.
All right.
Yeah.
Well, that's simple enough.
Yeah. And on there is the high cap page, and there's just a wealth of resources, as there's several buttons that people can figure out which of the 25 drug plans they have options to, Medicare resources. Now, one of the interesting things, there's also Medicare news. Did you know that there are new Medicare cards coming out?
Only because you told me a few minutes ago. But that's interesting. What's the thing behind that?
Fraud. You ever received calls to either invest with the prince in some other country, or you've won a lotto?
Yeah.
Sadly, in this day and age, fraud is rampant, and they are preying on seniors. The announcement that Medicare is going to be releasing new Medicare cards has been no different. Now, the number on your Medicare card, what's the number on your Medicare card? Don't tell us the number, but what is that number?
It's your Social Security
Social
number.
Security number. And we know in this day and age that that's a pretty important number, and people can do some real damage if they get a hold of that number and your address and your name, etc. So recognizing that, Medicare, starting next year, will be rolling out new Medicare cards that will have a random number, like most of our cards do.
Mm-hmm.
Obviously, it's a big project, but they will be doing it systematically. But even now, the crooks have latched onto that, and they're calling people saying, hello, this is Medicare calling. As you are familiar and have heard, new cards are coming out. We're calling to verify to make sure that we get you a card and everything. So we have your address as, of course, they've gone on the computer to get the address.
Yeah.
And we need you to read, just verify the number that's on your current Medicare card so we can make sure that it's the same. So unfortunately, the person inadvertently gives their Social Security number, which is exactly what the crooks are wanting. An important note, will Medicare ever call you on the phone?
No.
They will not. So the power a person has is to hang up. So be on the lookout. There will be Medicare cards coming through. And an important note, make sure that the address that Medicare has, and you can go onto Social Security, mysocialsecurity.org. I believe it's .gov. It's one of the two.
Okay.
And update your address, because that's where they will send your card.
Okay. So if you don't sign up when you're 65 in that 7-month window, then you won't get any correspondence, right?
Correct, because they don't have you in the system. You're not on Medicare yet as far as they're concerned, and in some cases, if you're not drawing Social Security, you have to sign up independently. If you're drawing Social Security, they automatically send you your card.
When I first started learning about Medicare, I couldn't believe how complicated it seemed to be. And, maybe for somebody that's been in the business for a long time, it's simple, but you have Part A, you have Part B, you have Part C, you have Part D.
Correct.
You have Part D has 25 options. I mean, there's a lot to know.
Yeah.
And I'm recommending that anybody that is 62 and older start finding out now about what's going on so you can think about it for a while and decide what you want to do. But my question more directly is that you probably recommend that everybody sign up for Medicare. But
That depends.
Okay.
Because there are instances where, for instance, if someone is still actively working and they have an employee group health plan, they can defer portions of their Medicare because it's redundant to what they may have. So these are some of the technicalities that unfortunately people don't understand, and so often the A in HICAP is advocacy. So often they set an appointment only after they're in trouble, and they didn't realize. So the criteria is actively working. But in some cases they retired. Part of their retirement package was continued benefits, but Medicare says actively working. So once their benefits terminate from their retirement package, then they come in 2 years later saying, I'm ready to sign up for Medicare, and then we have to unfortunately educate them that, well, you now have 2 years worth of penalty that stays with you the rest of your life because you haven't been actively working. And that's the criteria. So,
But if you're actively working, there's no penalty.
Correct.
But you still need to sign up. Or can you delay the sign up?
You can delay the sign up for portions of it. Actually, well, now we're into the mix of it. Federal health care, yes, it is a challenge. If you've worked at least 10 years, Part A, the inpatient portion of your Medicare, has no monthly premium. So with that price, why wouldn't you sign up?
That's worked 10 years and paid Social Security.
Exactly.
Okay.
Well, we see the deductions come out of our paychecks.
Right.
That's what it was for, was Part A of your Medicare.
So you can sign up when you're 3 months prior to your 65th birthday, you can sign up for Part A.
Yes.
And if you've worked 10 years and paid Social Security, a minimum, then there will be no fee for your coverage on Part A.
Correct.
Okay?
Yeah.
And so Part B is different than that, and C and D also, right?
Correct. Yeah.
So can you explain to us, I think most people know Part A is like going to the emergency room and probably other things too. Can you give us the ABCD
Sure.
education?
Sure. Boy, the real brief version.
Yeah.
So there are two ways that a person can have their Medicare. One way is called original Medicare that has 4 separate parts for a complete healthcare package. Part A is your inpatient. That's what we've been talking about. When you're admitted, the doctor writes that admission order, and you're admitted into the hospital, admitted into skilled nursing, admitted into hospice. Part A is where some of those charges go. If it's the hospital, it's only your room and board. Oh, you want a doctor? That's billed under Part B. Part B is the outpatient portion. So the ambulance ride to the hospital, Part B. The doctors that treat you, Part B. Maybe you broke your shoulder. So the sling, the wheelchair, the walker, medical equipment, Part B. The third part of original Medicare is Part D. D stands for drugs, prescription medications. And that's through independent companies that have contracted with Medicare. Each year it changes. A few years ago it was 31 plans. This year, 2018, there's 25 plans. And the plan you choose is specific to what medications you're on, because every pill has a negotiated price. And how many pills are there out in the world?
Too many.
Every pill has a negotiated price. So Part D for drugs, prescription drugs. And the last part is a Medigap, an insurance product called a supplemental that you buy, which covers the deductibles, co-insurance, and co-pays related to Part A and B of your Medicare. That's original Medicare. 4 parts: A, inpatient; B, outpatient; D, drug plan; and a Medigap product.
So is that C, or is C
Nope.
something else?
C is something else. C is the second way you can have your Medicare. If you take those parts and you give them to a managed care plan called an Advantage plan, potato, Advantage plan, Part C, same thing. They are managed care companies that have contracted with Medicare, such as Kaiser, SCAN, HealthNet, and it varies by county. Here in Solano County, Kaiser is your only Advantage plan option. For people who live in Lake County, there are no Advantage plan options. For people who live in San Francisco, you talk with some of your friends, they may have 30 Advantage plan options. An Advantage plan is an HMO, pre-approval, pre-authorization, network clinics, network doctors. They do provide a few extra benefits. There are some benefits that Medicare doesn't cover: vision, dental, hearing. And approximately 32% of Medicare beneficiaries nationally have their Medicare through an Advantage plan. It's less expensive on a monthly basis, and you get extra services. But again, you have those hoops to jump through that someone on original Medicare would not.
And some of those hoops are?
Pre-approval, pre-authorization, network doctors, network clinics. You have to go to your primary care first to get a referral and pre-approval for your knee surgery to then go see the specialist.
So there's probably a menu of options for the Advantage plans that are available. You can get a Cadillac plan or
No.
it's one.
If you sign on to Kaiser, Kaiser is Kaiser. Here's your monthly premium, and here's what's covered. And the question is, how much is your copay as you know, $25, $30 to go see a primary care, $35, $40 to go see a specialist. You know, everywhere you go, you have a copay, but it's capped. And once you reach that cap,
Is it a high cap?
good one. It could be.
Yeah, hopefully not too high.
No. But there is a maximum out of pocket that once you reach that, you don't have to pay any more copays for the rest of the year.
Okay. So is that payment to the Advantage plan in lieu of the payment that will be required for Part B Medicare?
No.
You still have to pay the Medicare.
You still have to pay. Your Medicare is your Medicare. Whether you have it this way or that way, you still pay your Part B Medicare. But if you go the Advantage plan route, D is part of the package, so you don't have to pay for that. The Medigap is part of the package, so you don't have to pay for that. But the Advantage plan may have its own premium. So the Part B premium, which this year is $134. plus whatever the Advantage Plan premium might be, would be your monthly.
So the Advantage Plan clearly has advantages, but
Yeah,
it has a cost associated with it, and so you're paying for more coverage, actually, because Medicare doesn't offer
true.
the vision and dental,
Mhm.
stuff like that, and hearing. So that takes me back to a scenario where, let's say you retire. Let's say you're 65, but you keep working for another couple years.
Okay.
Under that scenario, when do you have to sign up for Medicare Part A or any of it?
Well, Part A, there's no price. If you've worked at least 10 years, they call it 40 quarters. So if you've contributed at least 40 quarters, 10 years worth, Part A has no monthly premium.
So everybody should sign up for that.
The price is right.
Yeah.
Sure. So sign up for A, and then as you continue working, when you stop actively working, that's when you would want to sign up for Part B and a drug plan and take advantage of a Medigap supplemental plan. Or sign up for B and then have your Medicare through an Advantage plan. Your choice. There's no wrong answer.
Right. And so the cost, if let's say then you retire at 67, and then you sign up for the Part B, you don't have the penalty because you were working.
Correct.
Correct.
You were
Okay.
able to defer that. Of course, there's criteria, actively working, and they look at your employer and the details of whether you have what's called creditable coverage.
Yeah.
And that's an important piece to make sure you verify.
Okay.
And again, those are some of the technical aspects that becoming educated about your health care makes such a difference.
So we also hear about a thing called the donut hole.
Right.
And I think it's unrelated to break time for police officers.
That's correct.
It's mostly a definition of the range of your out-of-pocket for Part D. At some point, you're not covered, and then you get covered again at a higher level. And so there's this gap where there's no coverage. Is that what they call the donut hole?
Close.
Close, all right.
You're right. It relates to Part D, the prescription portion. So through the year, as you fill your prescriptions, the total of your prescriptions adds up, and once it reaches a threshold, then you fall into what's called the donut hole, in which you pay a higher percentage of the cost of your medications. And you continue to fill your prescriptions till you reach a second threshold, at which point you come out of the donut hole. And for the rest of the year, you have a very low, what they call it, catastrophic coverage, or a catastrophic amount, which is not very much, $3 and some cents per prescription for generics or name brand. But then every year it starts all over. And some people may fall into that donut hole the third or fourth month of the year. With the Affordable Care Act, prior to the Affordable Care Act, when someone went in the donut hole, they had to pay 100% of the cost of those medications.
Yeah, I remember that.
Affordable Care Act said we're filling it in with the goal by 2020 to have no hole.
Yeah.
And right now, I believe it's 50-some% of the cost of the pills is what you're paying when you're in the donut hole, with the goal being each year to have that hole filled in.
Yeah, a lot of people are unaware that that was another one of the benefits of the Affordable Care Act.
Correct.
So my other question is, first of all, the penalty is a 10% penalty that stays with you the rest of the...
Rest of your life,
Of your
or
life.
as long as you have Medicare.
So
Right.
if it's $134 a month and you don't pay it, then it's $13.40 for every year that you haven't.
That's correct.
And then, so that'll be tacked on the rest of your life. So if you retire and you have health care coverage, if you're lucky enough to have health care coverage provided by your former employer, what are the circumstances where you would need to sign up for Part B under that scenario?
Well, of course, actively working is the first criteria. So if you're still actively working and you have a group health plan, you can push that off. The minute you stop actively working, is when you would sign up for BEAD. Now, of course, there are situations where people are state or federal employees, in which case their benefits are structured somewhat differently, and that's a case where I'd definitely recommend someone on CalPERS or CalSTRS coming in and talking with one of our counselors, or setting an appointment to talk with one of our counselors to really understand, because there are some things that they want to make sure to not do, perhaps signing up for a drug plan, because that would have an overall effect on their benefits. So there's some unique aspects.
So people in general should assume that when they're no longer actively working after 65, that they should be signed up for A and B at least, and then be paying the monthly premium of $134. And then check it out to make sure that your current employer isn't covering you in some way where you don't have to. But maybe, I'm just saying, by default, assume that you have that liability or that responsibility.
Well, the responsibility is to be educated about your health care. I mean, whose responsibility is your health care? I mean, is your doctor looking out for your best interest? Oh, maybe the caseworker is. And your family is well educated, so they're aware of all of the pieces. Well, no, ultimately it's your responsibility, and that's where HICAP can really help you. So then when you step out there and you're needing to make this, or you're preparing to make these decisions, or preparing to make decisions you didn't even know you needed,
yeah,
that's where we can definitely make a difference.
All right. Well, we're almost out of time. Can you, for our audience, repeat again the phone number and the website that they can go to get more information?
Sure. To set an appointment, you can go to www.sasnb.org, and the phone number is 800-434-0222 to set an appointment with the HICAP that's nearest to you.
And if you're lucky, you'll get Frank, who knows everything about it.
All of our counselors are well versed. And even on our website, if you have a loved one or a friend that lives in a different state, on our website you can access the phone numbers for the different SHIP offices in different states, so they can get this same kind of help.
Cool. Well, unfortunately, that's all the time we have for today. And I'm still a little confused, but maybe that's just me. But I know where to go to
You know where to go.
I know where to go and who to talk to get the information I need.
Perfect.
And I hope our audience does too. So thank you for being here today. I really appreciate it.
Thank you.
And we'll make sure we get you on again sometime in the near future.
That would be fine.
If you're available.
We'll see.
All right, thanks.
Thank you.
Well, that's all the time we have for today. Our show airs at 6 p.m. on Tuesdays and Thursdays at Comcast 27, AT&T UVerse 99, and streaming live video at vcat.tv. Come see us again next time.